Today, I'll be discussing cellular adaptation. Cellular adaptation are reversible changes in the size, number, phenotype, metabolic activity, or function of cells in response to changes in their environment. Cells must constantly adapt, even under normal conditions, to change in their environment. The cause is excessive physiological stress or some pathological stimuli, bring about adaptation. That is, the cell modifies its true structure and function in response to changing in demands and stresses. It then acquires a new but steady state and perseveres its health. Let's talk about what happens if cells are exposed to certain stress, which can disturb the cell's normal state. It can lead to cell adaptation. If the cell wasn't able to stabilize the excessive stress, it will then lead to cell injury. Afterwards, the cell progresses into a severe and progressive state. It will become an irreversible injury. Worst case scenario, there is no turning back. Otherwise, it can cause necrosis or aprosis, apo- apoptosis. In other words, cell death. On the flip side, if the cell injury is mild or transient, it will lead to reversible injury. Therefore, the cell will overcome its injury and returning to a normal state or its homeostasis. For example, let's say if the horse is always racing if the horse is always racing and the muscle fiber experience excessive stress throughout the period of the session. During the race, muscle fibers of the horse is going through a lot of stress, which adaptation occurs. Afterwards, due to consecutive races for a few weeks, the muscle wasn't able to recover well and adapt to the situation. Then the horse had agreed to muscle tear, or an injury. Since the injury was minor, after a few days of rehabilitation, the muscle cell of the horse was able to recover and return to its homeostasis. So, next. So, adaptation can be physiological or pathological. Physiological usually represent responses of cells to normal stimuli by hormones or endogenous chemical substance. For example, temperature regulation, wherein the body will adapt to the environment temperature by releasing antifreeze proteins to avoid freezing in cold environments. Pathologic share the same underlying mechanism, but they all but they allow the cell to modulate their internal environment and thus escape injury. So, through the word patho, which means suffering or abnormal state, pathologic adaptation occurs during an injury, disease, or an abnormal function in the cell. So, so therefore, the cellular adaptation is the state that lies between normal cell and the injured cell. Next is the adaptive changes in cell growth. The most common morphological apparent adaptive changes are hypertrophy, which increases in cell size, hyperplasia increases in cell number, atrophy decreases in cell size, metaplasia changes in cell type. So, the adaptive changes in cell growth that we shall consider first is atrophy. Atrophy is the shrinkage in size of the cell from a loss of cell substance. It is emphasized that although atrophy cells may have been diminished function, but they are not dead. In atrophy, there is this term autophagy, which means auto means self and phagy means eating. That means the cell is slowly eating itself, and this is the process on how atrophy undergo. So here are the causes of atrophy. First is physiological atrophy. For example of this is the uterus of a mother decreases in size after giving birth. So second is senile atrophy. Senile atrophy. The aging process is associated with cell loss. Senile atrophy is general atrophy involving all cells of the body, but certain cells show it earlier and to a greater extent than others. For example, the testes and ovaries are among the first to show senile changes, where the testicles shrink as men age. And then, due to aging process for women, atrophy for their ovaries is normal and it is very noticeable during menopausal period. Another example is our brain. Due to our increasing age, our brain shrink in size. So starvation atrophy. During starvation, glycogen and fats are the first to disappear. Then the proteins of the body musculate. And finally, the proteins of the vital organs. This result in marked muscle wasting. The fourth is disuse atrophy. In this there is a disuse atrophy. In this there is a reduction of the reduction in the size of the cells as a result of a decreased workload or inactivity. Example, when a dog has a fractured arm that had been cast, the muscle on the leg will then get small due to weeks of inactivity of muscles. The fifth one is denervation or neurotrophic atrophy. Normal function of skeletal muscle depends on its nerve supply. For example, damage to the nerves leads to rapid atrophy of muscle that supplies them with blood. The sixth is angiotropic atrophy. Diminished blood supply like anemia, ischemia, or chronic passive congestion may lead to atrophic changes. For example, parasitic ischemia caused by a Strongylus larvae by the occlusion of femoral artery leads to atrophy of hind limbs in horses. Seventh is pressure atrophy. Pressure atrophy occurs when a mild mechanism force is applied continuously to cells over a long period of time. Basically, it is due to malnutrition associated with ischemia. It is commonly observed in tissues adjacent to tumor abscesses and hematosis, as well as in the neck, shoulders, and backs of horses when collar and saddles are pressed. The last is endocrine atrophy. Endocrine atrophy occurs either from loss of endocrine stimulation or from excessive endocrine secretion. Take note that atrophy is not to be confused with hypoplasia. Hypoplasia is one of the important growth disturbances, which is the failure of cells to attain their adult size under formation, while atrophy occurs in cells that have reached their full development. Although atrophy may have diminished or less function, but they are not dead. Moving on to the second is hypertrophy. It is referring to an increase in the size of cells that result in an increased size of the affected organ. Pure hypertrophy occurs only to those organs in which cells have lost their ability to divide. For example, skeletal and cardiac muscles. Uh, Basically, hypertrophy is a way of cells to adapt to stress that is given through expanding itself that will increase the performance of an organ. The different causes of hypertrophy are physiological hypertrophy, which increase functional demand, hormonal hormonal stimulation, and the effects of growth factor. For example, uh, the ma- the massive physiological growth of the uterus during pregnancy involves both hypertrophy and hyperplasia and occurs from estrogen stimulation. The second is adaptive response. Due to an increase Due to an increased workload or stress, the cell undergoes physiological or pathological hypertrophy. For example, just like what I have stated earlier, when a horse undergoes stress during a race, its muscle fibers increases in size to adapt to the given workload, to be able to cope up with the stress, and to prevent injury. The third is compensatory hypertrophy. This forms This form of hypertrophy may be a physiological or pathological response. It is usually the result of an impaired function of an organ. For example, unilateral nephrectomy. As you can see in the figure, the first is a both normal kidney. When it undergoes unilateral nephrectomy, due, due to the removal of the left kidney, the other kidney that is left will have to do the excess work that is given. Therefore, it becomes larger in size due to the increased workload. Moving on to our next presenter.